Hello and welcome. My name is Garrett Hollenbeek, and you're watching Ounces Over Pounds, where we meet with the experts who are changing the public health landscape. Today, we're meeting with Carole Kamangu, infection prevention and control consultant with Dumontel Healthcare Consulting. Carole, we're excited to have you on today.
Thanks for having me. It's an honor.
So, Carole, we noticed you first through LinkedIn and all of the great stuff you put out there. But we also heard about you through a few other podcasts, and you have a pretty unique story and a unique perspective. And so we want to first just have you tell us a little bit about yourself and what brought you to public health.
Okay, well, my name is Carole Kamangu. I was born in the Democratic Republic of Congo, and I've been in the US for almost 20 years. Um, I grew up in Africa, so that's really where my first love for public health started. I was growing up in the capital city, but I was multiple times seeing on TV how in areas in the eastern part of the country families were being displaced because of war. And that's when I really started having an encounter with infectious diseases. I was hearing about cholera at a very young age. Then years later, I started hearing about Ebola. And myself also, when I was, I believe, 7 or 8 years old, I was infected with amoeba. And my mom told me that I almost died from it, just from drinking, you know, unpotable water from school. Suffering from malaria multiple times a year. You just know, that's at some point you start being interested in this field. So from me just experiencing those diseases and seeing on TV all the time people displaced because of infectious diseases, I decided that one day at first I wanted to become a physician and work at the front line, at that time I wanted to be a surgeon. So I wanted to be a
Okay.
surgeon in public health on the front line, traveling the world. As a kid, you always
Yeah.
have those grandiose dreams. So that's where I really started thinking about public health. Then I became a nurse in the US because I decided that I didn't want to study for too many years and I was ready to start
Yeah.
caring for people.
Yeah.
But when I started in the hospital, I knew that my love for public health was not going away. I was only impacting one person at a time, but I still
Right.
wanted to help on a larger scale. And that's when I decided to go get my master's in public health. And I've been a public health professional since.
That's pretty incredible for a couple reasons. One, you have such a personal experience with these diseases that can spread rapidly and are
Yes.
very community focused.
Yeah.
And then two, having that background as a nurse and being able to care for the individual um, really makes a unique combination. Now, when you look at especially your unique perspective, what do you see or what do you observe that's maybe different than other public health professionals that comes out of your unique perspective?
Mm, could you clarify what do I see in what sense?
Yeah, so I know, for example, like my background is in sterile processing. And
Yes.
so when I do rounds in a hospital, any surgical instrument, I've got my eyes on it. I'm making sure
Yeah.
that it's open, that the integrator's there, that everything's, the way it should
Yes.
be. Some of our other infection preventionists, if they come from a lab background, they're looking at lab results a different way. So I'm
Right.
guessing based on your uh, clinical background and then your personal background that you see some things maybe different than other people will or
Yes,
notice.
that's a great point. So before I became a consultant, my last job as with the official title, infection
Mhm.
preventionist, because I had already come from public health, working in communicable disease epidemiology, also
Mhm.
doing infection control. My mindset is really revolving around systems thinking and epidemiology. So what
Mhm.
I've noticed, for example, when I would look at our infection rates and our patient line list,
Uh-huh.
my mind would always go to where did they catch this from? So I would always have an epidemiology mindset. And I've been on some contracts as well with long-term care facilities when they would report COVID-19 cases. I would always look at it also from an epidemiologist standpoint. Even though let's say I'm doing an ICAR in that facility, looking at an infection control program, I always go beyond that and ask them to think about what's going on in the community and how that would affect them. And I give advice regarding Candida auris when I'm speaking with a director of nursing, for example, who says, "Well, we're not worried about Candida auris because we don't take those patients." Then I help them think about it in a different way, and I tell them, "Well, you are in an area where we've seen cases in other hospitals,
Mhm.
so there's so much control you have as to who you can admit because at some point you may take this patient. So this is the time that you need to get prepared because it's around you. You can't really just limit yourself to what's going on in your facility because you're getting patients from the outside." So my mind is always public health inclined in everything I do for infection control.
I think that's such a great perspective because we always kind of hope and,
Yeah,
think maybe this isn't going to hit our facility or
right.
we're not. And Candida auris is a fine example of that. I know here in Southwest Ohio, it was a hot spot for a little while,
Yes.
and then it tapers and, taper towards the fall. So then you start thinking, is there a, time of the year? Is there a environmental
Right.
element here? Are we going to see an uptick in the spring and summer? But if we just hope it goes away,
That's not
things
the
don't
right,
work like that.
yeah. That's
Yeah.
right. That's not the right mindset. I agree.
So following up on something you said there, system thinking, that's how do you teach that?
Whoa, that's a
I
loaded
know that's
question.
it's a big one. Yeah.
For me, I would say it comes with the job. You really learn to remember that you're part of a larger system.
Mhm.
Uh, for example, for me, I never see myself, even just with Dumontel, I've been asked before, well, how do you see yourself as part of the healthcare system? I
Mhm.
see myself, my company, as this group of people bringing their contribution because we're not just this isolated piece of the puzzle, we're working within a larger puzzle. What we're doing in healthcare facilities or coaching individual infection preventionists, we're also impacting their facilities and it
Mhm.
helps them also see things on a broader scale. So yeah, I would say the way I teach other people systems thinking is always reminding them that what you're doing is impacting this larger ecosystem that you are part of.
That's exactly right. Because these patients don't come from nowhere. They come in from the
Exactly.
community, they're with us
Right.
for a few days, and then they go back out into the community.
Right. Exactly. Exactly. So if you give the wrong advice, they're
Mhm.
just going and spreading whatever they brought from your hospital. That's
That's
right.
exactly it.
Yeah.
So, knowing that you work with clinicians, how is your work impacting the clinical space right now?
Uh, I would say, let's say a worst case scenario, if you are as an infection preventionist providing the wrong advice,
Yeah.
there's a trickling effect, there's a snowball effect where
Okay.
things just get worse to worse to worse. One thing, for example, I say to new infection preventionists that I work with, when
Mhm.
they say, well, I don't know what to give as an answer when I don't know the answer. That's where
Yeah.
I remind them, you never want to give the wrong answer because what you do or what you say impacts this oral surgeon,
Yeah.
impacts this primary care provider, or even just the nurse manager on the unit.
Yeah.
Let's say, for example, you see a TB patient who's isolated the wrong way, and you provide the wrong answer because you want to look smart, and but you don't know the right answer. The fact that that patient stays isolated and using the wrong precautions because you provided the wrong answer will affect other patients who would get infected with TB. Staff will get infected with TB. Then it's all your fault.
Yeah.
So that's really what I teach, really making sure that we are, first of all, humble, knowing that
Mhm.
we humans, we are never going to be the best at anything, at everything, I meant. So just knowing how to say that I don't know the answer, but let me double check so I can find the facts and give you the right answer. And for me, I really think that's how we impact clinicians by just being truthful, having a collaboration with them, and also giving them the right answer, finding the right resources for them.
And that you hit on such a key thing because it can be challenging and we may want to say what we think is the right answer. Maybe it's
Yes.
wrong citing the source, but
Yeah.
it is so important that we give the right answer and almost the right answer the first time because the
Yes.
margin for error is pretty slim in
It's
a
pretty slim.
healthcare setting.
And another great example I can give, working in the hospital as an infection preventionist, I
Mhm.
was once working on an SSI project. I was leading the project to reduce colorectal infections,
Okay.
and I was observing those surgeries, and I made a recommendation to one of the surgeons who was there, and my recommendation was wrong. And I was glad that he called me out on it. And he said, well, I have looked at the ARN. Those are not the guidelines. Then I
Mm.
had to take a step back and remember, well, when you don't know, you can't just generalize on everything. This is a
Right.
specific setting. So I apologize for that. I said, thank you for calling me on that. I'll go and review my information again. So from then on, I was able to give the right answers to OR surgeons because I went and looked at the right resources.
That's kind of worth it being wrong one
I
time
know
so that the rest of the
exactly,
time you're in
and
good
it's a
shape.
and it's a big impact when you
Yeah.
when you have the wrong answer. And if he didn't know the right answer, then he would have he would have implemented the wrong recommendations.
Right.
Yes,
That can be a challenge for new infection preventionists to
yes,
when you speak to humility, humility is a soft skill, just like
it is.
leadership or good communication. And
Agreed.
I've had to do it myself and apologize and say, hey,
Yes,
I was incorrect or I told you the wrong thing, but let me correct that now.
that's right.
Um,
Yes,
and people in healthcare, they're very warm and welcoming generally and very, very forgiving when an apology is offered. That's
I
been my
agree.
experience at least.
I agree. And as you said, it's really a soft skill. It comes with
Yeah,
time. You don't learn it on from the get-go.
that's
Yeah.
true. So moving out from the individual setting and the individual clinician, how is your work impacting larger community spaces?
With what I do now, for example, Dumontel gets involved not only in the healthcare setting but also the community level, mostly through volunteering. We've been doing activities, for example, where we went to a national night out event in a homeowner community, and we were
Oh,
teaching them about infection prevention, hand hygiene. We had games for the children.
hmm,
Just learning how to clean their clothes by pretending they had, uh, germs on them. And we were teaching
very
them
cool.
how to wear, don and doff their gloves properly, and donning and doffing their masks as well. And it's a bigger impact because it's the community outside of
Mhm.
what we as infection preventionists in general are limited to, which is the healthcare setting. And
Right.
infection prevention is not just limited to the healthcare setting. We have infection prevention. It's in I mean, in post-educational settings. So
Mhm.
really for us, being able to have a larger, more open-minded mindset, knowing that we can impact in different settings is really what I think that's where we're going. Yeah.
I think that's important because if we can keep people out of the healthcare setting, if we can prevent that from happening, and I love that you guys are working with, kids and communities and teaching those skills early. I know for myself, I've got 15 nieces and nephews, and
Oh,
a
yeah.
lot of nieces and nephews in the area.
Yeah.
And my son, very good at hand hygiene, and that's just kind of his
Nice.
personality. It doesn't hurt that his dad's an infection preventionist, but we always hear, oh, he's got a great immune system. It's like, yeah, because we start those skills really early and
That's right.
make sure they stay sharp. So
I
I think
agree.
that's great work.
Thank you.
Um,
Thank you.
in your work in the community, what trends are you seeing, or what trends are you seeing in public health right now?
In public health, well, this one is pretty negative, and I think we all know as infection preventionists, especially since the pandemic,
Mhm.
there's a very low trust in the healthcare system, in
Yeah.
infection prevention, and in public health professionals. I find myself sometimes working with leaders in healthcare settings who have a hard time trusting that they can work with public health, and that's where I take some time to educate them that public health is really there to help them. But it takes some education because in some settings it could be a very, very small town where they don't usually work with public health, so
Mhm.
they feel like working with public health is a way to get punished for having gaps within their facilities. So I think for us as infection preventionists and just public health professionals in general, we pretty much going back close to square one
Yeah,
because we have to re-educate the community on the importance of our work and how it's protecting them. And we're also seeing with the anti-vax movement, we have a lot of people scared of any vaccine now. It's
sure.
not just
Yeah,
COVID-19 vaccine. I have people really close to my heart when we have discussions. I don't recognize them because they used to take vaccines, that now they don't take any vaccines
right.
because they believe that we're trying to do some mind, healthcare professionals are trying to do some mind control with the vaccine. So I really think we are back to square one. We have to do a lot of teaching at this point.
I agree. Teaching those basics of, you
Yes.
know, these germs are real, whether we like it
Yeah,
or not, and we have to approach things as the facts are on the ground.
that's
Um,
right.
I think we, and you have an international perspective on this, so you see things maybe with that unique lens.
Mhm.
We've gotten somewhat used to not hearing about measles, growing up,
Yes.
or not hearing about some of these infections that spread pretty rapidly. And now we're hearing about them more and they're cropping up a little bit more. I had a
Yes.
conversation the other day about tetanus, and the person had asked, we don't really hear about tetanus anymore. Why do we need, a vaccine for it? Said,
Right.
well, that's why we don't hear about it much anymore
Right.
because we have a pretty widely circulated, but those are hard conversations to have.
There.
Do you have any best practice tips or advice on how to build that trust?
Uh, I really think from my personal experience is
Hmm.
it also depends on, it mainly depends on your approach. There are, and also also the person you're speaking with.
Yeah,
Some people are very set in their mind, so it's gonna take a while.
yeah,
But my approach is usually being very kind about the information I'm providing it as education, and also respecting their mind, their thoughts. Sorry, I
yeah.
speak French, so sometimes
No,
words
that's
just get
perfect.
stuck in my brain.
Yeah,
Yes, and just respecting where they're coming from. Very early in my career, when I didn't really think about active listening, I was really bad at that. I would say to a patient, for example, this is very good for you. You need to take it. And if the patient says, I don't want it, that would be I would either feel bad about myself or that would be it would almost feel like a power struggle. But with
right.
time, I've learned that I'm here providing the education. It's really for them to leave it or to take it.
Yeah.
They have the right to reject education. They have the right to reject care. And we know it, especially in the US. Any patient can reject care if they choose to.
Right.
But for us, our job is really just educating, being kind, really utilizing our active listening skills,
Yeah.
repeating what they're saying to make sure that we understand where they're coming from, and
Mhm.
providing the facts. It has worked with some people that I've discussed with because I provided facts. With other people, I had to provide an anecdote, and the anecdote is actually what touched them the most because they could relate to the person. And
Mhm.
unfortunately, there are some people where none of them worked. So,
Yeah.
yeah, so it will really depend on the person and what they choose to accept as education.
I think that you hit the nail on the head with that. It's, knowing that people care. People often, they do want to feel heard.
They
And
do.
sometimes people just need to hear their objections or their fears, because it is scary
It
for a lot
is.
of people, especially in an inpatient setting. People are scared and there's a million thoughts going through their head. And sometimes being told to do one more thing, it it hits different when somebody has listened to you first and
That's
really
true.
let you air your fears.
That's true. That's very true.
So for public health folks working in any space with the trends that we're seeing, what tools should they have in their toolbox to be ready for the future?
Education, education, education is my best answer for that. If you don't stay educated, you don't stay aware of what's going on around you, you always fall behind. Whether you're an epidemiologist or infection preventionist, we have so many free resources we can access, and also others that are not free but affordable that we can access. And I also think for infection control from an emergency preparedness standpoint, we all need those skills. We all need to be trained to know what could be the next emerging pathogen.
Yeah.
And even pathogens we haven't seen, like you said, like measles that are coming back, we always need to
Mhm.
stay in the know. Knowing where our resources are is really what's going to equip us the best. I feel like, for example, when I was working in the hospital as an IP, I always
Mhm.
stayed educated. I always, even now as a consultant, I'm subscribed to all the emergency preparedness and
Good.
notifications possible. CDC healthcare health alert network is one of the best ones. Also, ProMed is also a very good one. I see a lot of trends from ProMed.
Mhm.
Um, One good thing I know, for example, I was checking my ProMed notifications daily before COVID came in. Started, it came into the US. And I remember my colleague and I, who are very like big nerds of emerging emergency preparedness, we
Uh-huh.
were looking at those emails daily
Yeah.
until one point we said, this is coming to the US. And you know, we were in Seattle. We knew it was coming to us first because we
Yeah.
were closer to China. And yes, it came to us. So yeah, really being subscribing to any type of notifications that work, local, state public health, federal public health, and also the World Health Organization is a very good resource to access.
Excellent. Those are important resources, and I love what you said about education. If you're educated, you
Yes.
stay ahead of it. Yep, that is great. Well, Carole, this has been a pleasure to talk to you. How can people reach you if they want to touch base or pick your brain or reach out for consultation?
Yes, so if anyone wants to work with me, they can reach out to me at info@dumontelhealthcareconsult.com. Dumontel is spelled Dumontel. It's a French name, so it's sometimes hard to spell out. But I'm also on LinkedIn, Carole W. Kamangu, and they can find me on LinkedIn. And I don't work alone. I work with other consultants who are, are experts in different fields than I am expert or have other interests than I have in infection control. So if they reach out to me and I can help them, I always have someone who can help them on the team.
That is great. Awesome. Well, Carole, thank you so much for your time and your expertise. We'll see
Thank
you.
you so much. All right.
Thank you.
Thank you.